morning, everybody. To let you all know, this presentation does carry one CEU point. Please look out for instructions on how to claim this during the course of the webinar. We will be placing a link and we will tell you when we do that. Please make sure that you complete your all your information in full. For the people who does have HPCSA numbers, please add that so that we can submit this to claim your CEU points. Okay, then before we continue any further, I just want to read through a disclaimer. Okay, this webinar is provided for educational and quality improvement purposes only. Discussions and examples presented are illustrative and may not apply to every participant, PT scheme or PT provider. Materials were prepared in good faith from current best practice, experiences and ISO standards at the time of delivery. While efforts were made to ensure accuracy, no warranty is given as to completeness or suitability for a specific scheme or participant. EQA or PT is used synonymously in this session. Please note that this session is being recorded, and unfortunately, some people did ask us to have a translation available for this session, but we could not provide it for this session. Okay, so we're going to move on now to give you an overview of this webinar that will be conducted by Talia.
Good morning, everyone. As Rachel mentioned, we did receive quite a lot of questions and not all of them can be addressed in this webinar. So I'm going to give you a quick overview of this webinar, which is covering topics that we will be addressing. The first one is Introduction to EQA or PT and Laboratory Quality, the relationship between ILC and PT or EQA, EQA or PT requirements under ISO 15189, investigating failed PT results, troubleshooting poor performing analytes, risk management and PT performance, alternative assessment approaches, common laboratory challenges with PT programs, corrective action, preventative action and continuous improvement using PT results. And then the last topic is future of EQA or PT and digital quality management. Thank you.
Hi, morning everyone. I'm Vijay Padayachee and I will be taking you through some of the questions. Like Talia and Rachel said, we did receive a whole lot of questions, and what we did was we tried and condensed it so that we could address as much as possible. So the first one is basically introduction to EQA, PT, and ILC. External quality assessment, as we use the acronym EQA, proficiency testing PT, and interlab comparison ILC. Please note that these three are very closely related, or maybe the same as per your definition. Quality assurance mechanisms are used in the labs to evaluate and improve accuracy, reliability, and comparability of their results. Please remember that these components are very important in accreditation and meeting the requirements of any conformity standards such as ISO IEC 17025, ISO 15189, and ISO 17043. What is the difference between PT, ILC, and EQA? These three terms are used interchangeably in this session, but I'm going to make it simple, not ISO definitions. Simply put, PT is a formal program that assesses the lab performance as per target value or consensus. Remember that for PT, one has to enroll as a participant. PT is a requirement for accreditation or for compliance. ILC may be informal or ad hoc or formal, You would, if you go to a testing or a calibration lab that uses ISO 17025, and you won't hear them talk about PT. It's more about ILC. Okay, ILC is also used for method validation and verification, just comparison between two labs. So ILC, interlab comparison, is between two labs and more. My suggestion is try and use more than two labs when you are using ILC, especially if you do not have a target value. Um, EQA is the same as PT, but it is used in medical labs. If you look at ISO 15189, there is no mention of PT as such in the title. It is EQA, right? External Quality Assessment. So, whatever definition you use in your management system, my suggestion is you define it. Okay, define what PT is, what ILC is, and what EQA is. Um, yeah. The next one is, what is the difference between quality assessment and quality assurance? Both have the same acronym, QA. However, we always confuse one with the other. Remember, quality assessment measures your performance, that is like your PT and your audits, right? Quality assurance is a system of processes ensuring quality. It is a bigger component, it's a bigger picture, and QA, quality assessment, is a small component of quality assurance. Why is PT a prerequisite for accreditation? Okay, so the first thing we need to understand is that PT is just not a box ticking exercise. It is very important for accreditation because it proves a lab's results are worthy, trustworthy, it aligns with international standards, and it also ensures continuous quality improvement, which is another cornerstone of accreditation. Without PT, accreditation bodies cannot verify that the lab meets the required level of competency. And the other thing is that PT, being a requirement for accreditation, is actually governed by ILAC. ILAC is now called Global ACI, but we'll talk about that later. There are two documents that gives you direction on how to handle PT, in the sense your PT plan, and why it's required for accreditation is ILAC PO9 01 2024 and ILAC G18. Please note that for your application for accreditation, the lab must have had at least one round of performance that they can submit with their application. It is a prerequisite. Without your PT results, your accreditation body might not accept your application. Okay, EQA PT ILT requirements of ISO 15189 2022, and the clause is 7.3.7.3, ISO IEC 17025 2017, the clause is 7.7. And just I'll give you a short overview of ISO IEC 17043 2023. Okay, PT is a requirement for these conformity standards, those two. And basically, the title in these standards, the clauses, is assuring validity of results. So, what the assessor would look for when they come to assess these clauses in your lab, you need to have a policy on PT participation or EQA participation. You need to have a procedure on how PT is handled and managed in your lab. Records from the time of receipt of the PT material to submission of results, including all raw data. Okay, you need to have a PT plan for the accreditation cycle, and this must be rolling. When I say rolling, I mean it is real time rolling. So if we have a 5-year plan and you start in 2026, you need to have a plan from 2026 to 2011. Come 2027, you will add on another year of plan, right? But you don't delete 2026. So basically, at the end of it, you should have a 10-year plan, which is 2 accreditation cycle. So I'll speak about a plan a little bit later. Then the very something more important as well with these requirements is the assessors want to see that the labs have actually done a risk assessment on how they determine the level and the frequency of participation in PT. Okay, then the overview of ISO IEC 17043-2023 is basically a conformity standard for proficiency testing providers. Please note that if you are going to use alternate methods, which we'll speak about later, you should actually follow the requirements of ISO IEC 17043-2023. Okay, again, this one, what is the minimum and the maximum years before another EQA PT ILC can be carried out? Okay, here, this is where your plan comes in place. Verify with your accreditation body, okay, what is the minimum, what they allow. Most accreditation bodies have regulatory documents. With SANUS, there is the R48 and the R80 that will give you guidance on how to do your PT plan. So go to your accreditation body and you will find that information there. Okay, what is the significance of PT as a whole? Okay, most of us do PT because it's a requirement for accreditation, but there are lots of benefits of doing PT. Okay, I'm just going to go through some of them, but you know why you want to do PT. So basically, PT demonstrates technical competence, right? It provides independent evidence that a lab can produce correct results for specific tests and measurements which accreditation bodies require. It also enables regulatory and market acceptance. We all know that if a lab is accredited, we know they are participating in PT. And PT is going to assure us of the quality of results. Very important, it detects systematic and random errors that assist you with troubleshooting. Then it also reveals biases, calibration issues, sampling problems, and just weakness in your IQC that your IQC may not pick up if you are not using third-party controls. Okay, it also drives continuous improvement. It identifies training needs and may also provide case materials for staff development. Very important, it validates implementation of corrective action. And then the last one that I have is PT supports validation or verification and also uncertainty measurements. In medical labs, we don't use it for that benefit. But if you go to 17025 labs testing and calibration, PT for them determines the uncertainty of measurements. Okay, transition from ISO IEC 17043 2020 to ISO IEC 17043 2023. What are the effect on the participants? Okay, so what has changed in the version? Basically, it is more risk-based thinking and impartiality are emphasized. Providers now have to document risk assessment and have stronger impartiality safeguards. This version is now harmonized with ISO IEC 17025, 2017 version, and ISO 13528, the 2022 version, when it comes to the scheme design, stats, reporting expectation. These are now aligned with the newer standards. Then also the information management and data handling requirements are more explicit in this version. What are the effects to the participants? Okay, so the participation instructions and reports may change. There is more rigorous provider oversight, meaning the PTP might request additional requirements or documentation from you. There is no fundamental change to the submission of results. So basically, there is no effect on the participants as such. Most of you would know that most of the PTP have transited to the new standard, new version, and that deadline is end of the month, end of May 2026. Okay, risk-based thinking. When selecting EQA, PTA, and ILC level and frequency, how to apply risk factors. Okay, so this is something I said to you that the assessors are going to look at. The participant should consider levels of risk affecting the lab, especially the sector which you operate in. Firstly, determine which are the high risk analytes that you have. When defining your PT plan, which is an accreditation requirement, ILAC requirement, risk must be taken into consideration, determining the level and frequency. Remember, your proficiency testing provider has already looked at the risk when they determine the rounds per cycle. However, the lab now has the choice to go and decide on the frequency that they want to enroll for. But before you do this, you need to look at the risk of your lab before you can cut down that frequency that is recommended by the PTP. So, what are the risks that you will take into consideration? Firstly, look at the technical risk, right? Some of the factors that you look at is method stability, complexability, the traceability of the method, right? This high risk requires high frequency of PT participation. Then we have operational risk, which is basically staff experience, turnover, sample volume. Once again, high risk, high frequency. Then you've got external requirements, right? These are regulatory and customer needs. Now, here, these needs, your regulatory requirements and your customer needs determines the frequency, not you. And then result risk, right? The importance of the data that the lab, you that are providing, right? And the applicability will determine the frequency of your participation as well. Okay, please note, accreditation bodies do not accept cost as a risk. So you cannot say because this PT is very expensive, I'm going to cut down on the actual frequency. That is not allowed. Okay, so we had a question how to handle lack of budget to participate in EQA program for all tests. Okay, so here we just giving you a suggestion um, that you can look at alternate methods instead of using a formal PT or EQA. And the suggestion also is, or advice, is to contact your accreditation body for more information and then let them know your challenges and maybe they will be able to assist you on this. But rule is or policy is, if you want a method to be accredited, there is EQA available, you need to participate. Where can we get more information on statistical analysis of PT data? Okay, so here, your method for your PT scheme will have its own way of analyzing the stats. That information comes in your instructions to participants from your provider. If you don't have that information, you can contact your provider and ask for it. Then the other useful resources that I found that you could use is ISO 13528, right, which you have to buy. And also the CLSI documents are also for sale. They're not free. But if you go to Eurochem, they have a Eurochem PT guide that you can use for practical worked examples. Then the ISO and the CLSI documents, that is for more formal rules that are used when providing or analyzing PT data. And remember, each scheme is different. So that is why we could not discuss this more in detail. Okay. What are the strategies for sourcing or developing alternate PT or EQA schemes for niche analytes not covered by our current provider? Specifically, guidance on how to meet accreditation requirements for scope items where formal PT is not available. Yes, PT EQA is an accreditation requirement. However, you are allowed alternate methods if PT or EQA is not available. The keyword is not available. You, as a lab, will have to provide evidence that you have tried to source the EQA. Submit this evidence to your accreditation body and indicate to them what is the alternate method you will use to show competency, technical competency, right? Provide your SOP, your schedule, all the documentation that you will use for the alternate method. Okay. Um, and then very important is basically you are asking your AB to give you permission to use that alternate method, right? Get that approval in writing from your accreditation body and keep those records. Some of the ways that you can use for alternate is ILC, interlab comparison, comparing results between labs using split samples, right? Rechecking or retesting. This is intra-lab where you do the testing within your own lab blindly. So we call it blind testing. Then certified reference material or reference material. You can use this to verify accuracy, which also helps with showing metrological traceability. Very important when you're using alternate methods. Please make sure that you define all the required documents for the alternate method and get that approval from your accreditation body. You need to justify to your accreditation body why you're using alternate methods. Okay, why is review of PT performance important? Okay, so reviewing of PT detects the trends, recurring biases, your training needs. They inform CAPA, yeah, your corrective action, your preventive action, and also management decisions are based on how you perform in PT. This review is also evidence of communication. Okay. Also include all technical staff in the review. Include PT review in your management review. And most important, in staff meetings. Let the review of PT be a holistic approach, meaning include your management and your technical. Don't let it just be management review or technical review. It has to be holistic to give you the benefits. This, how to use EQA for verification. This is a whole topic for its own. Due to time constraints, we cannot fully discuss it. All I can say to you is that using EQA for verification is permitted by ISO 15189 and ISO IEC 17025. You can use retrospective EQA results, or you can contact your PTP or any PTP to source panels or previous PT material that you can use for verification or validation. This type of PT is called a single occasion PT, meaning you have the values, you will have to determine the fitness for use, not the PT provider. They will give you what the target value is. What you have to do is define a verification protocol, which includes the acceptance criteria and how you will do it. Either testing or using previous results. Once that is done, you would then carry out the stats as per the method, and then, very important, do a verification report indicating whether it has passed the acceptance criteria. Okay, so this is from ISO IEC 17043, how to address clause 7.5.3, surveillance of processes. Okay, surveillance in the standard basically means that the PT provider, so this is not for the participant, it is for the PT provider. The PT provider must run a continuous documented program which monitors the scheme performance, right? Impartiality, data integrity, and participant risk. So simply put, surveillance is monitoring of quality indicators that the PTP has defined. So it's nothing hard to do. It's basically what we all do is monitoring quality indicators. Okay, so this question, how can we prevent collusion in PT? Okay, so the provider may use randomized unique samples. They can keep the participants' IDs confidential by using participants' numbers instead of names. They can maintain strict confidentiality systems. They can also sign non-collusion declarations and enforce penalties from their side. Okay, then for me, I'm saying it's not only the PT provider's responsibility. It is your responsibility as a participant as well. The lab should also take steps to prevent collusion by informing staff on an ongoing basis on the consequences of falsifying and clouding of results. Okay, how to choose the EQA, what to do when rare tests that have few participants and performance evaluation is not statistically significant. Okay, so all the labs, they need to establish an adequate PT participant strategy with the aim of participating in the relevant PT schemes, not just for accreditation. And once again, frequency appropriate to the risk of what they are doing. When you select a PT scheme, right, within your area of technical competence, these are some of the questions that you should be asking. What level of PT and frequency do I need based on risk? Do PT schemes exist for the various areas of technical competence? Is the PT scheme relevant? Does it cover your reference range, the parasites that you encounter in your country, right? So for me is if you're using a national PT provider, this normally covers your area. The other thing is when you are selecting also, make sure that the PT provider is independent of manufacturing or marketing interest in equipment, reagents, or calibrators in the field of operation. Okay, where participation in PT is a requirement by a regulator or a funder, you have no choice. You would have to do the frequency as determined by them. Okay. Then the last part, if a scheme has few participants, then don't participate because there is no benefit. It's registering with the PT provider because it's a requirement for accreditation is not going to benefit you. Inform your AB, right? And look maybe for alternate methods because you pay a lot of money for PT, and if you are not going to get the benefit of actually participating, in my opinion, you are wasting your money. Okay, then this is a website. I put a screenshot where you can find PT providers that are accredited. So this is the ILAC website, right? You can still search for it, but please remember that ILAC is no longer in existence. It's called the Global Accreditation Cooperation Incorporated. So in short, Global ACI. If you go to this page and you search under scope, proficiency testing, it brings up all the accreditation bodies. So Lab TQA is accredited by A2LA. If you go and click on A2LA for proficiency testing, it'll bring up a database of all the PT providers that are accredited by A2LA. So this is something that is very useful that you can use when you are trying to source a provider that is suitable for you. Okay, how do we obtain material in correct reference range? I think I said this should be one of your criterias, right? When you are sourcing a PT provider. Population, every country has got its own population reference range. Using a national PTP would help in this, but very important as well. Once you are registered, that feedback to your provider is very important for them to plan and design the next cycle. So you need to give feedback. This is my range, and it is not covering my range, so that they could plan this in the next cycle. If you cannot do that and you need that that range to be covered, you can look at even spiking that sample to obtain your for it to cover your reference range. So there are ways to do it. You just need to find it, and your PTP has to cover your reference range. Okay, so I think, sorry, Talia, that is the end of my questions. So I'm going to hand over to Talia, and she's going to take you through the rest of the session. Talia?
Hi, everyone. Before I go into the next slide, I just want to remind everyone that there is a Q&A function on this webinar. So if you do have any questions, please go to the Q&A section. If you do struggle to find it, you're welcome to put any of your questions in the chat. Just be sure to leave your email address, your contact information, so that if we're not able to address your question during this webinar, we do have the ability to contact you thereafter. Okay, so my question is, what is the purpose of instructions to participants? The purpose of instructions to participants is to provide the laboratories with all the critical information needed to correctly process and report your EQA or PT sample. This ensures accurate, reliable, and comparative results between laboratories. It also helps ensure that EQA performed reflects the laboratory's true routine performance. The instructions for participant is one of the most important documents in proficiency testing because the PT provider communicates all the essential information on this specific instruction. Laboratories should read and understand the instruction for participants every time before testing. And if anything is unclear, it is crucial that you reach out to your PT provider and try and understand the instruction before handling your sample. The instructions for participants contain scheme-specific information which may differ between programs. And this scheme information is your sample preparation requirements, storage conditions, result interpretation guidance, marking or scoring criteria, as well as report instructions. It also highlights some important factors, and these important factors can definitely affect your results, so it's important that they are taken into consideration. This is your sample issues, method bias, any collaboration issues, operator skills, and instrument maintenance. It provides guidance on correct preparation, labeling, storage requirements, and also maintains the cold chain requirements. Following these instructions are extremely important. You need to ensure that you follow the instructions for participants together with your laboratory's SOP, staff training, and internal QC processes. This will help you to maintain quality standards that support accreditation requirements and also ensure that you are getting reliable results. Okay. The next slide I'm going to cover is troubleshooting poor performing analytes. This process requires you to perform a structured root cause analysis to identify the true source of the problem. The process can include, but is not limited to, the following items. You will start by reviewing the poor performing analyte immediately and confirm that there was no transcription or submission errors. This is important to ensure your analyte is correctly registered and the correct method and instrument is correctly registered with your PT provider, as this will also determine the peer group that your result falls under. You will need to assess whether the issue affects the PT sample or may also impact the patient's results. You will need to investigate possible contributing factors, including personal, equipment, reagent, methods, environment, and sample handling. It is very important here that I mention the instructions for participants again. You will need to go back to this document and ensure that you have handled the sample correctly as per the instruction for participants. You then have to perform corrective and preventative action processes to address if there's any issues or anything that may have gone wrong. You will ensure all investigations, findings, corrective actions, and follow-up activities are fully documented. Here are some other possible items that you could check. You could check your instrument collaboration to identify if there's any issues. Review reagent-related factors such as expiry date, storage conditions. Verify instrument maintenance records. And consider if any environmental factors, if applicable, has affected your result. And this can include temperature, humidity, power interruptions, and cold chain management. You then can review staff competency, SOP adherence, training records, and operator techniques. Once all your laboratory-dependent factors have been reviewed and are compliant, it is important that at this stage you raise it with your PT provider, as they will be able to review from their sides and provide further insight on where possible issues may have occurred. In some cases, it is possible for your PT provider to provide you with a repeat sample, and that way you can start the process all over again. You will use poor EQA or PT performances as an opportunity for continuous quality improvement within your laboratory and monitor that the effectiveness or any corrective and preventative actions that you have installed are resolved and applied correctly. I hope this will help you with troubleshooting your next poor performing analyte. I'm now going to hand over to Rachel.
Thank you, Talia. Okay, so the first question I'm going to deal with is how to deal with common laboratory challenges with PT programs. So there's multiple challenges that a laboratory can encounter for PT programs. Some of them are shipment delays, sample stability, customs import challenges, data submission issues, report turnaround times. So for shipment delays, ISO 17043 accredited suppliers should have a proper shipment plan in place that they stick to. But sometimes there might be factors out of their control causing delays to shipments. Some examples of this would be delays caused by manufacture of the samples, extreme weather, acts of war. In instances where there is such a delay, most proficiency testing providers will give an extension to the affected laboratories to submit their results before they cut off. They are, however, still bound to their internal accreditation processes as well as sample stability and expiration timelines. So that is why they might sometimes not grant an extension, but to the as far as possible, they will try and grant an extension. Then sample stability. ISO 17043 accredited providers will source PT material with the best stability for testing analyte, but it should be noted that some analytes are really unstable by nature. And this is then often designed as a scheme with shorter submission dates to try to ensure stability of the samples. Just to give you an example, for instance, there might be a cardiac sample and NT-proBNP might not be included in that sample because the stability of that one analyte is a fraction of the time of the stability of all the other analytes. So then they would split the samples out and they would have that analyte in its own because that's the best way to handle it. Otherwise, the stability for the entire sample would be so short that it would not be feasible for everybody to be able to test it within a good turnaround time. Then the next point is the customs import challenges. Unfortunately, this is a common challenge across the world. It's not just even in Africa, it's across the world that there are issues. And then the best way to address this is to make sure that you know of all of the local requirements that's needed by your customs agents. And then you make sure that you have all the information available before you actually order the samples and before it's shipped to you. The other alternative you can do is to order it through a distributor that can manage this whole process for you, that can have all the necessary licenses, the import clearance, and so on. Okay, then data submission issues. If you have any data submission issues, it should be discussed with your supplier so that they can assist you with training on the process of data submission. So all the suppliers have multiple platforms and they actually need to give you training on their specific platform because all the platforms differ and you need to familiar yourself with that exact platform. Then the next one is the report turnaround. Laboratories should be in contact with their supplier and lodge a complaint if they do not send reports in time. So you should be given a timeline for when reports will be given to you, and then that is when they should release reports. If they do not do that, then you should go and discuss it with your supplier. Okay, then the next question is how to self-evaluate, example, when EQA results were not submitted on time. Okay, so a non-submission should be treated as a non-conformance. So you have to document the reasons, perform a root cause analysis, assess your patient risk, and implement corrective action procedure. So you have to engage with your proficiency testing provider on how to self-evaluate. So different providers have different ways of evaluating their different ways of giving the data you need to use to self-evaluate. So you should, based on your provider, document the SOP so that all staff know how to do this. And then if there's enough interest from this webinar, we can look at covering an entire webinar on self-evaluation processes. So we'll look at doing that as a further follow-up webinar, because that is also quite intensive, that we can go into the exact steps that needs to be put together. Okay, so the next question is how to obtain feedback from provider to alert of possible solutions. So there's always a feedback link or contact details that the proficiency testing provider have. This is an ISO 17043 requirement. So you have to make use of that for formal proficiency testing provider communication. And you can always schedule a debrief call with them after your reports if there's something that you're not sure about within your reports, or like I said before, if you're struggling with any data entry or so on. Sometimes the participants say, we tried to call, but we were not getting responses. So I think what's important there is to make sure if you've used the correct channels, if the proficiency testing provider's contact details is correct, that you're contacting, because sometimes they have a specific channel that you need to follow. And then you have to keep a log of a provider communication and agreed actions. And then we've also had an additional question where we were asked, what do we do if the EQA samples were not received on time and subsequently not submitted? So the answer to that would be you have to do a self-evaluation. Okay, so my next question is what and why is homogeneity and stability testing? So homogeneity and stability ensures sample integrity throughout the round. Homogeneity ensures that all participants get the same sample composition and ensures that consensus results can be used. Stability testing ensures that the analytes are tested while they are still stable. So we had a question about how to decentralize panel production centers for easy distribution to enrolled laboratories. So it's important to note that for proficiency testing samples, it's not possible to decentralize them, because if this is done, then the PT material cannot be used for evaluation of the same round. When that happens, you can't use consensus results because all of the samples that you're going to circulate does not come from the same batch. And you need proficiency testing results to come from the same batch. So yeah, for that reason, it would be better to, instead of decentralizing your panel production, to rather just still produce it in a centralized area and then have distributors that can distribute it for you to all the different areas. Okay, so the next question is how to build competency and confidence in analyzing PT samples. Okay, so this question is basically the same way as you, when you're training yourself, they need to be competent when they analyze a patient sample. So you must ensure that the EQA must be treated as a routine sample. So only staff that have been deemed competent should be submitting EQA results. Okay. Then, how do you troubleshoot a shared sample to prove patients are not compromised? Also, PT sample stability hampers investigation and troubleshooting. So, sharing samples between different laboratories is not a process that's generally endorsed by proficiency testing providers. And this is one of the reasons because it makes it extremely difficult to troubleshoot where your sample or result has gone wrong, because it might be pretty analytical in the original lab that prepared it, and it's got nothing to do with your instrument or analysis. While investigating the root cause of this issue, you will have to include the sharing laboratory in your investigations, as they also handle the sample, and they could have compromised it at any point in them handling the sample. So it's really important when you share samples between different laboratories that you have a good way of knowing how each lab treats their sample. So I think you're going to have like a sharing policy between you guys to know exactly how it's treated. And unfortunately, if your result is out, you're going to have to ask the other lab, how did they treat the sample? Was the sample maybe standing outside for a prolonged period? Did they send it immediately to you? Did they just take an aliquot? Or did they actually reconstitute the sample? Yeah, so I know there's lots of questions that can be asked. And then also the sample stability. As I mentioned before, the proficiency testing providers really try to select the samples in such a way to make them stable. And that's why they sometimes remove certain analytes and so on. But there is still, unfortunately, we're not there yet where we can make samples that is stable indefinitely. So it is a factor, and unfortunately, for some of the analytes that's a bit more volatile, it makes your troubleshooting a bit more difficult because you can't just rerun the same sample that you had. There is processes though where you can prolong your stability for certain samples, like for instance chemistry samples and so on, where you can actually freeze them after you've run them to make sure that they are stable for a little bit longer than they would have been in their open vial stability. Okay. So the next question is how to coordinate PT in the cases of public health, emergency of international concern for emerging or new pathogens. Okay, then EQA is especially valuable during a public health emergency of international concern. Why? Because this is when laboratory systems are under their greatest pressure. Laboratories are often required to rapidly implement testing for new pathogens, introduce unfamiliar methods, manage high testing volumes, and work with evolving guidelines. Coordinated proficiency testing helps ensure that results remain accurate, reliable, and comparable across laboratories. This is critical for both patient care and public health decision making. So now I know the question is, well, there isn't always EQA available. Where formal EQA is not yet available for an emergency pathogen, laboratories should implement alternative quality assurance measures as early as possible. This may include the use of reference materials, inter-laboratory sample exchanges, method verification studies, duplicate testing, increased internal quality control monitoring, and close collaboration with reference laboratories and public health networks. These interim measures help maintain confidence in testing performance until formal EQA programs can be established. It is normally fairly quickly that proficiency testing companies bring forward a scheme when there is a international public emergency specifically. I think COVID's a good example of this. It was only, I think, within the first month where the first EQA schemes was already out for people to actually buy. Okay, so what are the criteria for dry chemistry and point of care testing? Okay, so dry chemistry and point of care do not usually follow exactly the same performance criteria as large central laboratory analyzers. This is because they are designed for different clinical settings, operations, and purposes. So for EQA assessments specifically, acceptable limits for point-of-care testing may sometimes differ from central laboratory criteria, depending on the technology, the methodology, and intended clinical use. The important principle is that the performance criteria should still ensure patient safety and clinically reliable results, even if the analytical specifications are not identical to those used for high-throughput laboratory analyzers. It's also important to note that often with point-of-care tests, the samples that is used is normally different samples, and it can't be like, for instance, now the chemistry, it won't necessarily be the same liquid sample that we use that all the instruments can register on. So there is a scheme specifically for that one point of care instrument, and it caters for the sample type, it caters for the methodology. So it is the point of care testing, it is still a fairly new field, especially in proficiency testing, where because it unfortunately there is factors involved that if you have to take a specific sample for a specific instrument, it is going to drive costs up because you can't utilize it under multiple instruments on one scheme. So there is lots of factors that needs to be taken into consideration with this, and this is a ever evolving area for proficiency testing. Okay, so the next question is, where do I get information on web portal navigation? So Talia is going to take us through that. I just want to give her control so that she can continue. Okay, Talia, you can continue.
Okay, so this question is, where do I get information on web portal navigation? So when we say web portal navigation, we're speaking about the PT provider system that they use to submit results, register your analytes, access reports, review performance statistics, as well as download your certificates. I'm going to take you through that in a second. I just am trying to change the slide. There we go. So as I mentioned, the portal will include sample and analyte registration, result submission, accessing various reports, reviewing performance statistics, as well as downloading certificates of enrollment. Generally, when a PT provider sends you login details, they also provide you with links to the user guidelines, video tutorials, or any support portals that is linked to you understanding how to use their website. These resources are included in your email or sometimes sent out as a separate email. Ourselves at Lab TQA, we have 3 different providers. So when you register with us for any of these providers, we share with you the instructions, tutorial, or support center links for each of these providers. If you don't have access to this information and you participate with any of the schemes with Lab TQA, you're welcome to let us know, and we will definitely share it with you. In addition to this, we provide training sessions where we help laboratories to better understand and navigate these portal functionalities. Should you wish to request any training sessions, please reach out to us and we're happy to support your team with this. So the next question is how to register new analytes on the portal. So this would be a very important step, and it would be the first step before you would get to submitting your results. Now, every PT provider system is different, but generally they all have screens or workflow processes that take you to the analyte registration as your first step. This includes setting up the analytes you choose to submit. So as you know that most samples have a variety of analytes and your laboratory may not need to test for all of those analytes. So your first step would be to select the analytes you are testing. Thereafter, you would need to input the instruments, which can be broken up into models, manufacturers, and you would choose the appropriate instrument and model. Same with your method or reagent details. And it's very important for you to ensure that you get this correct. You need to ensure that you register the correct instrument and reagent. Now, sometimes we have questions where models are not specifically clear because there may be a cluster of models listed on the system. In that case where you're not sure on where your instrument model fits in, you're welcome to send us the package insert for your instrument. And us as a PT provider, we will ensure that we tell you exactly which option to choose. As we mentioned earlier, it's important for this to be correct because this will define the peer group that your results get fallen into. So it is important that you ensure that this is correct. If you require any guidance or further assistance and you participate in any of the Lab TQA schemes, please feel free to reach out to us and we can assist you with this. Okay, I'm moving on to the next slide. Okay, so here's the important slide. All of the members that's participating in this webinar, Marcel's going to be putting a link in the chat now. Please can you ensure that you complete this link because this link is going to allow us to send you a certificate, and from the certificate you would be able to get your CEU or CPD points. It is important that if you are local that your HPCSA number is registered, and if you are not local, please ensure that your country is listed correctly. Okay, once again we mentioned that not all questions could be covered. We're definitely going to try to include some of the questions that couldn't be covered in future webinars. If you do have any questions now regarding anything that we have already mentioned, please, it's just a reminder to go and put it in the Q&A section. Okay, I'm moving on to the next. Okay, so this slide is going to be covering the schemes offered by Lab TQA. Lab TQA offers a wide range of proficiency testing and external quality assessment schemes through internationally recognized ISO IEC 17043 accredited providers. Our schemes support laboratories across chemistry, hematology, immunology, microbiology, blood bank, molecular testing, point-of-care testing, and many other more specialized tests. As you can see, all of the popular schemes are listed on your screen. Our monthly routine testing are designed to provide continuous quality monitoring throughout the year. This includes programs such as your chemistry immunoassay. We have a very comprehensive chemistry sample that includes 94 analytes. It covers some of your immunology samples, as some of your immunology analytes, as well as your therapeutic drugs analytes. We have cardiac markers, blood gas, blood oximetry, basic hematology, HIV, hepatitis, and a few other more schemes. One of the key benefits of our monthly schemes is flexibility. So we allow laboratories to choose how many rounds they wish to participate in. So even though these schemes run monthly and have a 12-month cycle, you can choose, if you choose to participate in fewer rounds for the year, to aid with costing, budget constraints, as well as tests that are not as frequent within your laboratory. So that is a good feature with regards to our monthly schemes. In addition to the routine tests, we offer specialized API programs that are generally conducted 2 or 3 times per year, depending on the program requirements. These include highly specialized schemes such as cryptococcal antigen. We have serum HCG, we have ABO-RH blood grouping, blood parasites, syphilis serology, and many others that you can see on your screen. If there is any scheme that you are looking for specific information about, you're welcome to let us know in the chat. We will be sending our catalogs for all 3 of our providers to all of the participants in this call. Okay, so the next slide is covering who is Lab TQA. So we are a South African-based total quality assurance provider dedicating to improving laboratory quality, accuracy, reliability, and compliance across Africa. Lab TQA was founded by myself as well as Rahul Otto, who together bring 25 years of combined experience in proficiency testing and external quality assessment management. We both were previously part of the leadership team at Thistle QA, which was one of South Africa's most trusted EQA provider, as well as a big provider in the rest of Africa. We played a major role in shaping EQA services and quality requirements across the continent. Lab TQA currently services over 300 laboratories in South Africa as well as in the African continent. Our strong focus is on making quality assurance solutions accessible, practical, and affordable for African laboratories. Our core offerings include external quality assessment and proficiency testing schemes, as we covered in the previous slide. We provide access to over 500 EQA schemes through internationally recognized ISO IEC 17043 accredited providers, including monthly routine tests, specialized tests, and customized frequencies. Lab TQA also focuses heavily on customer support and training. We assist laboratories with program setup, analyte registration, portal support, troubleshooting, and performance interpretation. Our goal is not only to provide PT samples to laboratories, but to partner with the laboratories in driving continuous quality improvement. We have flexible PT and EQA solutions that help laboratories monitor performance, improve accuracy, maintain compliance, and ultimately strengthen patient outcomes. We also have software solutions. Our software solutions are designed to support laboratories in managing their own internal quality control schemes as well as proficiency testing schemes. Our systems offer secure result submission, automated statistical analysis, real-time performance dashboards, and centralized quality oversight capabilities. These solutions are particularly valuable for laboratory groups, hospital groups, and organizations requiring standardized quality monitoring across multiple sites. In addition, we offer both managed and unmanaged solutions. So our software solutions have 2 models. This allows laboratories to choose the level of support and control best suited to their operational needs. For organizations wanting full ownership and oversight, our unmanaged models enables you to independently manage and administer your own PT system while still benefiting from robust, scalable, and compliant platforms. Alternatively, our managed solution provides ongoing technical, operational, and quality support from the Lab TQA team. So we are also here to assist you with all of your needs if you do have any software requirements. Okay. If you require any further information, on your screen at the moment is the Lab TQA details. So we have our general email where any inquiries can be sent to us and it will be directed to the suitable member of the team, as well as both Rahul and myself's direct contact details are on your screen. So if you require to reach out to us or require any further information or points that we have discussed, please feel free to reach out to us. Okay, so I know we've said a mouthful, but why choose Lab TQA? We are more than just an EQA provider. We are your total quality assurance partner. We focus on helping laboratories across Africa to achieve accuracy, reliability, compliance, and continuous improvement. What makes us different is our comprehensive scheme offerings, as well as our flexible round involvement. We provide access to over 500 EQA schemes and proficiency testing, routine monthly schemes, specialized testing, low frequency programs, CAP accredited schemes, and ISO ISC 17043 accredited providers. This allows us to match the right scheme for your laboratory's test menu, your budget, and your accreditation requirements. One of the things that we are most passionate about is ensuring that laboratories across Africa have access to quality solutions that are practical, affordable, and right for the African market. We understand the challenges faced across the continent, including logistics, infrastructure, and access to international quality programs. That is why we have built these solutions specifically designed to support laboratories within the African environment. We strongly believe in customer support and training, as we believe that this is just as important as the EQA program itself. Therefore, at Lab TQA, we don't believe in a one-size-fits-all approach. We provide tailored assistance, user guidelines, and we hold your hand through the whole process of PT. Together, myself and Rahul Otto, we bring 25 years of combined experience in PT and EQA scheme management across Africa. Our experience together and our partnership with international accredited providers allow us to deliver trusted, high-quality solutions backed up by real industry expertise. We offer a range of schemes done at different frequencies, as I've mentioned before. This would be monthly, 2 to 3 times a year, or flexible rounds to assist with various aspects from budget to frequency of testing within your laboratory. At Lab TQA, our mission is simple. We empower laboratories through total quality assurance. I hope that you found all of the information that we've provided insightful, and we're happy to take any further questions at a later stage. I am now going to hand over to Vijay, who's going to take you through the last part of this webinar. Thank you.
Hi. Yes, so I'm gonna just do a small summary about Vijay Consulting. Just my area of expertise, I work with a lot of ISO standards. These standards, I actually assist labs in building their capacity. I assist with establishing, developing, and implementation of management system with the disclaimer that implementation is your responsibility. I'm there to assist, but I'm not responsible for implementation. I get labs ready for accreditation and also compliance support. I also assist organizations that have multi-site organizations where we do one QMS that is applicable to all sites, and also document control systems. I've assisted with the paperless solutions, which is working very well, and also do internal audits, your annual internal audits. That does not have to be done by your staff. If you have trained internal auditors, you may do that, but you can also use an external person to do internal audits. I also assist with management reviews, just doing it the simple way. And then the other service that I provide, which I'm very passionate about, is training. Training on the different ISO standards, understanding the requirements, how to implement. The training is basically classroom. We do on-site or virtual. I don't do public training, and the reason being is that with public training, I find that the participants are not open to disclose what is happening in their labs. So training classroom is basically tailored for your organization. And when I do training, I don't know what happened there, but anyway, I am all about simplicity, right? When it comes to management systems, I use my international experience as an assessor, as an auditor, and also an implementer to optimize your systems. I try and make you the owner of your management system so that when I leave, the system is yours and it can still run without me being there. Like I said, I have a passion when it comes to knowledge transfer. I use a lot of life experience as an assessor, as an implementer, and an auditor, and also examples to ensure that you understand the concept or a requirement. And to end, before I know we still have time, so we are going to take questions, but I just want to say to all listening that yeah, I have this policy in life, and that policy, I'm a management person, right? So I don't have a quality manual, but I do have a life policy, and that is, it's not what I can give, what I can get from you, but it's what I can give you. I'd like to thank every one of you for taking the time to for attending this session. We really appreciate it. And based on your feedback, there may be more of these sessions. We still need to look at the feasibility of that. Thank you, and I'm going to hand back to Rachel. Thanks.
Thank you, Vijay, and Talia. We still have time left, and I see it seems like we've covered all the questions in the Q&A and chat box. So please let me know if there's any other questions that you want us to maybe address before we leave. If you can just put your notes in the chat or in the Q&A. Let me see. Okay.
Rachel, can you just
Yes.
tell them about the recording that it will be
Yes.
available? Yeah.
Yeah. So we'll just take some time to edit the recording, and then we will have it available where you can go and watch it again. And then we will, even for if there was anybody who missed it, we can still give CPD points afterwards once you've watched the entire recording. And then I also want to just remind everybody to please complete the link so that we can do for South Africa. Please make sure you add your HPCSA number so that we can submit your CPD points to the HPCSA. And then I do see that there is two questions. I just want to quickly see here. The one is, what is the, oh, I see Talia is responding. The proper channel contact details for raising issues with lab TQA. So Talia is going to respond that. She'll put the information for you in there. Then prudence, how do you do a corrective action for a failed percentage deviation when the STI and Z score is acceptable? Prudence, it's not something I can quickly answer. We'll see if we can get into contact with you. And then also based on this, we'll see if we can possibly, if there is interest for it, if we can arrange a more statistical call, which gives you these a better insight into these questions, the statistical questions, the calculations, and the corrective action and so on for that. Regarding the HPCSA, what if we are registered? I'm not sure I understand. Is it maybe not registered? So just to come back to that, every person who completes the form will get a certificate that we will email to you. What I can suggest is, I think what she might be asking is the HPCSA number is mandatory in the form. Just put NA if you don't have a HPCSA number. Yeah, I see she's saying not registered.
Yeah.
Yes.
Yeah. Yamuna is not from South Africa,
Yeah.
so
Okay. So you can just say not applicable for that part. Okay. I don't just want to check if there's something in the chats. Okay. So Denise, Jessica, I see. Oh, it's I think this is not Mola. I have a different scenario to lab. Yeah, I've answered my question on EQA frequency. Okay, oh, that's fine then, nothing to answer. Denise can't access the form. Marcel, can you maybe just paste just the link again? I don't know, Denise, is it not giving you access, or is the link not working? If you can maybe just say what's the issue?
Sorry, the link is there, but it's blocked by some other thing on our system at MPET.
Oh, in your system. Could you maybe try using it on your phone? Denise, can I ask you to can you pop us an email, then we can send you the actual link, then you can maybe, if you can access it from your phone rather.
I'll try and do it from my phone. Otherwise I'll send you an email.
Okay. Please. Okay, I don't see any other questions. There's Q&A. Okay. So I just want to check if there's anybody else who maybe wants to ask a question while we're waiting just to see if there's some final questions coming through. I just want to thank everybody for joining us for this session again. And then also for sending through all the queries, all the questions that you wanted answered, because like I said, we were totally overwhelmed. I know there is some specific questions that we didn't get to. Once again, if there was anything specific to our company or the products we offer, we would contact you directly to discuss that. For any other questions, we might have another session if it's feasible and address some of those questions. So we'll definitely still going to look at the questions that were sent through that we didn't cover directly in here, and see if we can find a way to cover it for you guys. Okay, so I don't see any other. Oh, Vijay, I think this is for you. Do you give audit training? From Christian
Yes.
Kasongo.
Yes, the internal audit training is based on ISO 19011, and then I would then check which standard you are using and adapt it so that you would get internal audit training and another a certificate to say that you understand the requirements of the standard. So please, if you need training, just reach out to me and we will try and do something. Thank you.
Okay.
Next one is yours.
And share the
Rebecca.
recording. Yes, we will share the recording. Please just give us some time. It won't be today or tomorrow, but we will send everybody who is in this mailing list who joined the um, event. We will send a link so that you can access the recording. Okay.
Thank you,
Talia,
everyone.
thank you.
Thank you,
Talia, did you
everyone.
want? Okay. Thank you, everyone. I hope you enjoyed this session.